Good day. Today lecture titled Multiple Organ Dysfunction Syndrome. By the end of this lecture, you have to be able to know the definition of multiple organ dysfunction syndrome, know the clinical manifestations of multiple organ dysfunction syndrome, and what are the risk factors, the pathophysiological mechanism of multiple organ dysfunction syndrome, what is the nursing assessment parameters to confirm the diagnosis of multiple organ dysfunction syndrome, and how to implement the nursing care plan based on a priority for patients with multiple organ dysfunction syndrome, communicate effectively with patients, family, and healthcare provider, and document your data and adhere to the code of ethics. As you know, dysfunction means inadequate function of the organ. So multiple organ dysfunction syndrome is considered when a progressive dysfunction of two or more organ system occur. So we can consider the multiple organ dysfunction syndrome or modes as a condition of uncontrolled inflammatory response to severe illness, severe injury, and organ dysfunction. So as we mentioned in the previous lecture of systemic inflammatory response syndrome, in which we, based on the pathophysiological changes, we consider the modes as a consequence of SIRS, which affect the patient's perfusion and oxygenation in different conditions, such as shock or severe illness. We can classify the multiple organ dysfunction syndrome into two main types: primary modes and secondary modes. In the primary one, there is a direct insult or injury affected the organ and resulting in organ dysfunction, such as in case of blunt chest trauma, which may predispose or leads to adult respiratory distress syndrome. While secondary modes or multiple organ dysfunction syndrome is a situation in which organ dysfunction occurs as a consequence to another insult or as a consequence of another condition occurred to the patients, such as host response impairment, which is mainly characterized by generalized activation of the inflammatory response in organ remote from initial insult, such as wound infection may predispose to sepsis or acute pancreatitis. In general, you have to know that secondary multiple organ dysfunction syndrome can be developed within 7 to 10 days post exposure to the primary insult. There are many triggering factors or causes predisposed to a multiple organ dysfunction syndrome, such as sepsis and severe sepsis, major surgery, or with post-operative major surgical complications, burned patients, shock state, multiple or massive blood transfusion, infections, aspirations, pancreatitis, patients with acute renal failure, patients with adult respiratory distress syndrome, and finally, necrotic tissue development. Regarding the pathophysiology of multiple organ dysfunction syndrome, four major criteria mainly manifested the patients with multiple organ dysfunction syndrome and occur in the following consequence. First, inflammation, then altered in coagulation, then impairment in the fibrinolytic activity, and finally endothelial dysfunction. So starting with the first response, which is inflammation, there is a site of insult due to injury or hypoperfusion or whatever the cause, this insult activates the inflammatory response locally, then predisposed to the release of various cytokines from macrophages, such as tumor necrotic factor alpha and interleukin 1. These we are calling them as pro-inflammatory mediators. Then this predisposed to activation of neutrophils and endothelium release of vasodilatory substance such as nitric oxide, histamine, and bradykinin. We call them as anti-inflammatory mediators. So both pro-inflammatory mediators and anti-inflammatory mediators predispose to the inflammatory response and resulting in additional capillary leak from the blood vessel and resulting in extravasation of the plasma and altered in the coagulation factors. Altered in coagulation factors usually very linked with the inflammatory process. As we mentioned before, in the systematic inflammatory response syndrome, it predisposed to the release of cytokines from macrophages, TNF alpha and IL-1, and lead to coagulation and platelets activation for the intrinsic and extrinsic coagulation cascade in the critically ill patient's body. This coagulation occurs at the level of microcirculation of each organ and then predispose the organ to dysfunctional and even death. Then the third response will develop over releasing of these inflammatory mediators leads to dysfunction of the coagulation pathway and affect the fibrinolysis activity, which predispose the patients to higher bleeding tendency, such as in a patient with severe sepsis, fibrinolytic activity may impair due to increased production of plasminogen activator inhibitor and thrombin activated fibrinolysis inhibitor. All these factors will result in inability to dissolve the clot. The blood flow will be reduced at microcirculation level and finally organ dysfunction and death will occur. That's why, as a consequence of inflammation, altered coagulation, and the impairment of fibrinolysis, endothelial dysfunction will occur. And as you know, the function of the endothelium to control the vasomotor tone and traffic the nutrients all over the body and maintain blood fluidity. Whereas the production of these inflammatory mediators as well as the toxins from the organism of infection or from the source of infection will result in maldistribution or abnormal distribution of the circulation and increase the microvascular permeability, which with altered in the patient's coagulation, it affected the patients and resulting in microthrombi formation as well as edema. Adding to this problem, the patient's the endothelial dysfunction will result in impairment of the vasomotor tone, as we mentioned before in systemic inflammatory response syndrome lecture, which is resulting in vascular relaxation and finally end with hypotension. Hypotension with impairment of circulatory blood flow, which finally result in organ dysfunction. As you remember, we mentioned this concept map for the development of systemic inflammatory response syndrome. How can it worsen and predispose to multiple organ dysfunction syndrome? Moreover, This concept map shows how the primary modes with more deterioration and systemic inflammatory response syndrome development can be worsened and developed secondary modes.